body, and in particular we're going to look at structures for the respiratory system that you'll need to know for your practical examination. Here's where we're looking at the skull. I want you to be able to identify the vomer, the perpendicular plate of the ethmoid bone, which create the nasal septum, the barrier between right and left portions of the nasal cavity. As we go over to the sagittal head, we'll do the sagittal head first. Okay. We're viewing the nasal conchae right here. Then we're going to view the tonsils. So we have the pharyngeal tonsil right here, the palatine tonsil right here, and the lingual tonsil right here. Okay. As far as the pharynx is concerned, your throat, there are three different portions or areas. We have the nasopharynx, the oropharynx, and the laryngopharynx. Here we can view the epiglottis, and here we view that's the epiglottis. Here is the true vocal cord or fold right here.
That's on the bottom, right?
On the bottom,
okay.
This inferior portion.
Mm-hmm.
There you go, thank you. And this is the trachea, and through in here, and this would be the esophagus right in this back. So this is the trachea. Here we're going to view the larynx, and here we can see again a representation of the epiglottis and the opening, okay, that is created between the vocal folds, the vocal cords, glottis, G-L-O-T-T-I-S, glottis, okay? Now we'll come over to this model. We're viewing the trachea here, and we'll view trachea right here. The heart has been removed. We'll look deeper in a moment after we look at the lungs themselves. So the left lung, we have the upper lobe, lower lobe, horizontal, not the horizontal, the oblique fissure. Now on the right side, we have upper, middle, and lower lobes. We have the horizontal fissure and the oblique fissure. Okay. Here we're seeing again the trachea. The bifurcation of the trachea, where it goes into primary bronchi, would be the carina, primary bronchi, secondary bronchi, tertiary bronchi, and then the bronchioles. And lastly, we have the diaphragm. Okay, very good, ladies.